Cranial nerve review. We're going to go through all of the foramen of the skull and discuss the cranial nerves that enter or exit those foramen and discuss what happens with those cranial nerves. First, we have in the anterior cranial fossa the cribriform plate. The cribriform plate is where the first cranial nerve, olfactory, will travel through, giving special sensory the sense of smell. Moving posteriorly towards the middle cranial fossa, we have the optic canal. The optic canal has the second cranial nerve running through it, conveniently named the optic nerve. Then in the superior orbital fissure, you have several different nerves running through there. You have the cranial nerve 3, cranial nerve 4, part of cranial nerve 5, and cranial nerve number 6. Cranial nerve 3 is called oculomotor, which is giving motor innervation to muscles of the eye. Cranial number 4 is trochlear, and trochlear is giving motor innervation to the superior oblique muscle of the eye. Cranial nerve number 6 is known as abducens, and it's giving motor innervation to the lateral rectus muscle of the eye. And the fifth cranial nerve, which is called trigeminal, a branch of trigeminal goes through the superior orbital fissure. The branch that goes through the superior orbital fissure is known as the ophthalmic branch. The ophthalmic branch will end up branching into several other branches. The ophthalmic branch of trigeminal is entirely sensory. The ophthalmic branch of trigeminal will go through the superior orbital fissure and break into the frontal and the nasociliary and the lacrimal nerves. The frontal nerve will end up breaking into the supratrochlear and supraorbital nerves. What they all do, so when V1 goes through the superior orbital fissure, the lacrimal nerve will go to the lateral aspect of the orbit and provide sensory innervation to the upper and lower lateral eyelids. The nasociliary will be going medially and give sensory to the bridge of the nose, the side of the nose, and the eyeball itself. The supratrochlear branch will end up giving sensory innervation to the medial aspect of the upper and lower eyelid, and the supraorbital branch will end up exiting the supraorbital foramen and end up coming all the way along the scalp back to the lambdoid suture, giving sensory innervation to the scalp. Moving posteriorly from the superior orbital fissure, we have foramen rotundum. Foramen rotundum has another branch of the fifth cranial nerve go through it, the trigeminal nerve. The branch that goes through here is called V2, or the maxillary branch of trigeminal. The maxillary branch of trigeminal will then end up branching into three different nerves. It will branch into the superior dental nerve, which actually itself will branch into three different parts, the anterior, middle, and posterior branches, to give sensory innervation to the upper teeth. The other branches are the palatine nerve, which will end up branching into the greater and lesser palatine nerves to give sensory innervation to the hard and soft palate. Lastly, you have the inferior orbital, or infraorbital, and it will go through the infraorbital foramen, and it will end up giving sensory to the area of the front of the face, over the maxilla bone. Sorry, the infraorbital foramen. Give sensory innervation to the area of the front of the face. Moving posteriorly, we see foramen ovale. Foramen ovale has another branch of the trigeminal nerve go through there. That's the mandibular branch of trigeminal, V3. The mandibular branch of trigeminal will end up branching into four different branches, eventually. The first few, one is called the long buccal nerve, which will end up coming through the foramen ovale and come out and give sensory to the cheek and to the inner mucosa lining the cheek. You'll also have the inferior dental nerve, which will enter the mandibular canal, give sensory to the lower teeth, and the inferior dental nerve will actually exit the mental foramen on the mandible to give sensory innervation to the area of the chin. The other branch of the mandibular branch of trigeminal is the lingual nerve. And the lingual nerve will end up going to the tongue and will give sensory innervation to the anterior 2/3 of the tongue. Now that we're on the tongue, let's just quickly discuss the tongue itself, because it gets innervation from several different branches. And you'll eventually see those branches as I get to them and the foramen that they go through.